So happy to have Dr. Karen Rhea here with Centerstone talking about community-based behavioral health care. Kind of a mouthful there, but so important in our community, talking about depression, bipolar disorder, and you provide services for both mental and physical health needs. Elaborate on that, Dr. Rhea.
Well, I think behavioral health care is so important because behavioral health issues are very common. And I think there's an increasing awareness that behavioral health and physical health disorders impact each other. So this has been known for a long time, but there's increasing data suggesting that this is a very important relationship.
They're so intertwined.
Correct.
And that is what you're learning, the data. Elaborate on that a little bit more. For example, if someone is depressed, that's bound to affect their physical health. In what ways?
Well, I think the patients who are depressed have a much higher incidence of physical health problems. And a really important finding has been that the coexistence of depression and diabetes or heart disease increases the risk of serious disability and, in fact, of early death, much more than just having high blood pressure or diabetes might.
Does one lead to the other, though? For example, if you have a heart attack, and after a heart attack, for example, I can think about my own father had a heart attack, and it seems he became depressed after that. You know, was that because of being sick? Obviously, you feel awful, but the lack of oxygen. I mean, I'm asking kind of a complicated question, I realize, but which comes first often?
Well, I think it can work either way, but we know that often people who have one disorder have the other. Mm-hmm. And with heart disease, we know that if the patient becomes depressed and it's untreated, that the life expectancy is lowered. So it's very important in individuals who have heart attacks or strokes to deal with the depression.
Mm-hmm. What are the signs you're looking for in these most common behavioral health issues?
Well, some of the most common illnesses would include depression and anxiety. So depression, patients present with increased sadness above what's usual in the situation, perhaps excessive crying, a sense of guilt, a sense of being worthless. These are patients who can have difficulty sleeping, a decrease or an increase in appetite. If we look at anxious patients, they present often with a sense of being nervous, restless, stressed. Anxious patients can have panic attacks where the heartbeat is racing, they're perspiring, and having a sense of doom. Also, these are individuals who have problems staying asleep or actually even falling asleep. Mm-hmm. And we know that both depression and anxiety can be underlying suicide attempts.
Mm-hmm. What do patients and caretakers, caregivers tell you that are some of the common misconceptions about behavioral health?
I think, and it's the same one we've talked about for years, it's the idea that people need to try harder, that if someone would just settle down and make an effort, that they could overcome their sadness or overcome their worries. But what we know is that depression really impacts the ability to try. It impacts motivation, it impacts initiative. And so if these are persistent and significant, they really need treatment.
And speaking of that, I know you have an integrated care approach at Centerstone. Explain how that works. What does integrated care mean?
Well, integrated care means that we attempt to treat the physical health disorders and the behavioral health issues at the same time. So we would make an effort to identify what physicians or services need to be involved in a certain patient's care, to identify the gaps in care for that individual. If that person has diabetes, we might realize they haven't had a blood sugar checked recently. So as a psychiatrist, I might need to ensure that the person goes to their primary care provider, deals with their blood sugar. And several of our clinics at Centerstone do have primary care embedded in that clinic site. Otherwise, we work to coordinate with the patient's physician out in the community.
If someone feels like they're experiencing symptoms of depression, anxiety, what should that person do?
Well, I think if it's an emergency, it's appropriate to go to the emergency room if there's suicidal thinking or intent. And for some people, it's appropriate to have a 911 call made. I think for most people, it's more chronic and recurrent, and an appropriate solution for that would be to communicate with their regular primary care physician and then to be referred to a mental health specialist. And that might be a psychiatrist, a psychologist, a social worker, a counselor, a nurse.
And don't be afraid to do it. Don't be embarrassed to do it. You are not alone. It's so prevalent in our society. Thank you so much, Dr. Ray, for your time. We really appreciate you.
Well, it's a pleasure to be here.
Thank you. And we'll be back in a moment.